next we'll have the Laurel Hill team step right on up.
Great. Well, thank you all for having us. We're here to talk about a housing project and give you an opportunity to get involved early because we are in the early stages of this. So I'm Devin Jenkins. I'm the Director of Housing and Facilities for Laurel Hill Center. And this is Brandy Rhodes Brooks.
Hi. Hi. I'm supporting the Laurel Hill Center team with community engagement, communications, and you all are our first stop in that journey. So thanks for having us.
And just as a little background, they have purchased the property behind where the filling station used to be, off of River Road, just north of Hunsaker. And the zoning for that property is perfect for multifamily housing. And that's their plan to help house the most vulnerable population in our community and help get them off the streets. And we're here to help them figure out how to make it a win-win for the neighborhood and the Laurel Hill Center and all the people who desperately need housing in our community.
Okay. So this is the site. We're proud to introduce our latest supportive housing project on River Road and Hunsaker Lane, a compassionate, proven solution that builds stability, dignity, and stronger community for everyone. And I wanted to point out that this, where you see the red dot, that's 45 Hunsaker Lane, and that's going to be the entry, the driveway to the property, and also have a community building. Right now it has a very old house on it that was used as a salon for a period of time and is now vacant. And then housing will be in the middle there, in the empty lot. And as far as I know and have been able to research, there's never been anything on that lot, ever. If anyone knows of anything, please do let me know.
Sorry. You want to talk a bit about kind of who Laurel Hill serves and what that looks like in the community?
Yeah, so Laurel Hill Center has been around for over 50 years, and we kind of quietly do our thing. We serve some of the most vulnerable people in our community that have mental health concerns and need support for their mental health, for their employment, and for their education and their housing. And we operate several apartment complexes all over Eugene, Springfield. We have sites in South Eugene, West Eugene, downtown, the Whitaker neighborhood, and in a couple neighborhoods in Springfield. And we've been doing that for over 30 years. And so our apartments serve the folks that I just mentioned with behavioral health programs, and they have staff support and resident support, and everybody has goals and hopes and dreams to belong to the community in a safe and productive way.
When I first started working with the Laurel Hill Center team, I started referring to them as Eugene's best kept secret because they've been around for a long time. They've been doing projects like this quietly in the community, improving safety, but also thinking about the whole community and all of the supports that they need to build stability and resilience. And they've been doing that as a nonprofit with very little fundraising and really smart people who are very dedicated to the mission. And so I think they have really exemplified what they're trying to do, but kept it quiet. They've kind of been that like community mover and shaker, but under the radar.
And I will add to that too, privacy is very important to our participants and our clients, and we want to respect everybody's privacy and dignity, and our apartment communities are that. I mean, you wouldn't know that Laurel Hill Center operates the properties that we do operate, and that's partly by design. We want to fit in and be a part of the community and improve the community.
So we'll talk about why permanent supported housing. So this is really an opportunity to create housing and stability, but also have on-site support and care. Permanent supported housing has been a demonstrated form of building community resilience. Typically, it has economic benefits to the neighborhood, it has health benefits to a neighborhood, and it does really great work to support the clients that are being served so that they can get whatever that looks like, get that stability to start to build a renter's history, get some things going, whatever that might be. So when we're looking at permanent supported housing, it's really about safe, affordable, and that like kind of connection and support. So thinking about how we build that connection with each other and support each other while giving folks that affordable, stable place to be. Yeah?
Yeah. So why this project matters: safe, stable homes for individuals who need them. And I kind of listed off a bunch of neighborhoods where we already have housing and we don't have anything in this area. And so that's part of why this project matters, because we serve people that live here and are already living in this community, members of this community. They've asked for it, and we have an opportunity to provide that. On-site support services that promote recovery and independence. Everybody that's going to live at this development has support from multiple workers at Laurel Hill Center for whatever their goals are. If their goals are strictly housing, then they have housing workers. If their goals are mental health and getting a job, then they have a mental health counselor and an employment specialist. And everybody that's on our housing services waitlist has a multitude of those supports. All of our projects and supportive housing projects in general across the country result in fewer emergency calls and improved public safety. They're well-lit communities, they're well-kept communities. We have a lot of regulations that we have to follow that are imposed by the state and the federal government to make sure that these communities are safe and well-built and well-maintained in order to maintain our funding, and also because that's the right thing to do. And that's why this is a long-term investment in the well-being of our entire neighborhood. Your entire neighborhood.
I would add to that, like really the focus on this is an investment, right? Folks can look at permanent supportive housing and have all kinds of questions, you've heard all kinds of narratives, but the reality is it's an investment in safety. It has economic benefits in terms of, I think it's about $28,000 typically to put someone in permanent supportive housing. If they don't have that support, and then they're navigating finding housing, potentially navigating being unhoused, it's about $48,000. So it's actually a long-term investment in safety and resilience and economic benefit to you.
So just again, this is the site kind of in the bigger perspective of the area. And the former owner, the seller, approached us because they were interested in our mission and values, and they wanted to make sure the property went to an individual or an organization that supported some strong values around helping people succeed.
So I feel like you've already touched on this, right? They have a lot of clients in the River Road area. As this community has continued to grow and develop, there's a need for services here, and there's a lack of those services in the community. So this is a tangible opportunity to support the growing neighborhood, but to invest in solutions that we know will help, and that will give support to your neighbors, your friends, your families who might need that. So it's all about thinking about that community connection and that thriving kind of ecosystem that we build. That's something I've been really impressed with the Laurel Hill team, is they're thinking about not building for the community, but building with the community. So I know Devin will get into some of those things as we get going, but it's looking at that whole ecosystem. How does it fit in with the neighborhood? How does it fit in with the community, and how are we making smart decisions to make sure that that integration exists, because that connection is part of the support.
So the vision: create a safe place for people with low incomes who require support for their behavioral health and housing stability to live and thrive. There will be on-site support services, and there will be a community building with offices and meeting rooms and a kitchen. And that will not only serve the developers, the people that live on site, but also others in the community that are looking for Laurel Hill Center's services and supports. There will be 4 ADA units and mobility enhancements in most of the units. We have a lot of clients that live in our housing, residents that live in our housing that age in place. They become very comfortable in our communities because they are safe and well communities. And we want to make sure that this property allows for that. 1-bedroom units designed for single adults and seniors to age in place. There it is. Community integration in the transit corridor near shopping and services. So as you know, that area's got pretty much anything anyone would need. And I will note too that only about 8% of our total resident population owns a vehicle. It's very small. So I don't expect the traffic to become an issue there in and out of the project. There will be, support staff that go in and out on a daily basis, but we won't have a lot of resident vehicle traffic. There's a very low amount of parking built into the project because we're just expecting that same demographic where residents utilize public transportation and they ride bicycles, and that's how they get around. So we are very early in the timeline. As Kate mentioned, we have purchased the property. So we closed on the property last year. And since then, we've been working on some schematic design. Some of those renderings you just saw were from that process to kind of get a concept of what we were looking for. And now it's time to get input, get feedback, and revise that design as necessary. And we've also been beginning to apply for some funding through the state of Oregon, through Oregon Housing and Community Services. We have a $2.5 million home. It's a HUD program. We have a $2.5 million grant already, and we have a grant from the Oregon Health Authority that helps purchase the property. So those are two partners that are invested in this project so far. And we are on the waiting list with Oregon Housing and Community Services Act for additional funding as it becomes available.
And I would add to that on the communications, as I mentioned, you all are our first stop, but we've been planning some things behind the scenes. So Laurel Hill will soon have information up on the website. We're looking at how we can maintain consistent communications over the course of this project and keep you all updated as things go, as things evolve, so we can continue to get the feedback and build this the community in mind. So this is really the start of communications, and we're looking at communications spanning through the full next year.
I expect, if things go swimmingly and we get funded through the grant opportunities that are available through OHC, Oregon Housing and Community Services, that we would be looking at breaking ground in late 2027 at the soonest, and completion by 2028, 29. It's a long process to do a housing development like this.
Okay, so what you can expect from Laurel Hill is we're going to have ongoing updates. Like I mentioned, there will be information up on their website, and we'll continue to update that on an ongoing basis. We will have opportunities for the community to continue to give feedback. We might come back and present to you all as we go through this process. And if you look on the tables, there's a flyer there with an email address. That's the point of contact. So if you have questions, concerns, and thoughts, we want to be as transparent and as connected through this communication process as possible. So please grab a flyer and make sure that you send us any questions and thoughts. Okay, I think that's the presentation part.
Yeah.
Okay.
Aside from the housing situation, how is your organization funded generally by the overall organization?
Oh, great question. Yeah. So most of our funding is through Medicaid billing. So we bill for our mental health services and our ancillary supports through Medicaid and other insurance. And then we have a number of housing related grants and contracts through local municipalities and the state, and through HUD directly.
Do you get any support from Lane County?
We do have some contracts with the county for some housing services and some behavioral health services that run through Lane County Behavioral Health.
Thank you.
You're welcome.
Joel?
You talk about on-site support. Do any of those people live on the site?
Good question. Yet to be determined. We will have support staff there daily that either are on my team in the supportive housing division, or there will also be all of those ancillary supports, employment counselors, case managers, depending on what people are looking for. And potentially a on-site manager, that's going to be part of our financial process as we work through the budget and the operating costs of the project. Good question.
Jerry?
Yeah, when we toured, I thought I saw some rough elevation drawings or something. Do you have drawings of what you're anticipating in terms of the building?
Ooh, I don't today. We could flip back to the one that kind of shows what the buildings are going to look like.
Okay.
And there's going to be 4 3-story buildings and 54 apartments total amongst those buildings, and then the community building kind of at that entry point.
I would add to that, there's a lot of green space and landscaping in there too. So when you do get to see the kind of aerial view, you get to see how they're looking at, there's a courtyard, there's some obvious landscaping, all the neighbors will probably get a new fence. So it really has a very green and community feel to the way they've laid it out. It's not just a bunch of buildings next to each other, right? So thinking about how that is all laid out.
And the design so far has been really guided by being trauma informed and understanding the needs of our residents that have sometimes experienced housing instability, or they've experienced homelessness, or they've experienced housing discrimination. And what does that need to look like in that apartment complex, that apartment community? And it needs to be very open. There needs to be lots of lines of sight. There needs to be different types of green spaces that people can visit their neighbors and enjoy the property. And we have built that in. I've asked for flat roofs so that we're minimizing our, upward visual impact in the neighborhood. And yeah, good question. What else?
I just, so the one thing, I think your guys' website and your mission is amazing. Whoever put your website together has done a fantastic job. So it's got a ton of great information on there, and I'm very supportive of it. The thing that I was concerned about as soon as I saw the location was, like, Beaver Hunsaker is just a crazy, crazy spot right now. We have people get hit on it all the time. And I've heard that Dairy Mart may end up having to shut down because people are shooting through that parking lot.
Oh, wow.
Because no one likes the new intersection. And it sounds like with only 8% of people owning cars, they're going to be probably going across to the LTD bus station. And there's just a little bit of concern about that. I don't know if this has been dealt with in other areas. And then my other concern with the LTD is that for whatever reason, I don't understand why, but 4J uses LTD for their busing system out here. And so that will be commingled with a lot of high school students. It just seems like, that certain individuals that are in high school are probably not the most, I don't know, I won't say it, but it's just, not the most understanding. And so I want everything to succeed. I was just looking at it from what could be hiccups. And I thought getting across that road and then getting on a bus with a bunch of high schoolers would cause me to go into a massive rage. I think anyone else have to go through that. Anyway, just something to take into account with that particular location.
Great points. I know that we have been talking with both the county and the city about the transportation related issues, and I know that they're looking at how to, what's going to happen with that intersection. I don't know any more than that at this point. I just know that it's being looked at as a safety concern. And then I think that our residents will not be on the schedule of a high school student. They will miss each other. So I think that'll work out. Good question. And I will keep that in mind.
Back here?
Hi, I'm sorry. So I have 2 questions. One, is this already decided that this is going to happen? And 2, I thought on the previous Santa Clara Community Organization meeting, I think that the limit for buildings in this area would be 2 stories. So I'm a little confused why the design is a 3-story building. Maybe I'm just.
I can address the height limitation. So C2 zone property throughout the city is allowed to be 120 feet tall. So this is a C2 zone property. In our neighborhood planning effort, we specifically said that it seems outrageous for our neighborhood, and our limit is 65 feet. So this still comes in well below the height limit for that zoning for that location. Just as a point of information.
Okay,
It's going to be about 35 feet, 40 feet-ish. And I've heard that concern, absolutely, and I wanted to make sure, that's why we did the flat roofs, just to minimize that impact as much as possible. Totally agree. And
the first question.
yeah, so the property's purchased, there's funding already secured, and the city's has approved the initial set of plans and the zoning.
And just as a background, R1, single family residential, height limit is 35 feet. So it's not too egregious in terms of 3 stories and not being much taller than a single story newly built house.
Good questions, yeah.
I don't have a question. I just want to say that there is a lot of understandable push for affordable housing that we need, and much is being addressed. In most cases, what's lacking is follow-up services to help the people in affordable housing be successful. And being on the board, we did a tour of Laurel Hill and went to one of your units. And I'm very, very, very impressed that what I see from you all is the focus is your residents being successful. Having all of the services that allow, and the words that you use for thriving lives, that's lacking in the mentality of the people who are building affordable housing. There's no follow-up service for people who, and not everybody has learned how to be successful in housing. So I'm really impressed with what you are doing and the focus that you have and caring about the people that you're serving.
Thank you. We've been doing it for a long time.
Yeah,
And we've got a very successful.
very
model.
successful.
Yeah.
Otherwise, people would know more about you.
Right.
One more, will your construction contractors be local?
So far, and this could change, but at this point, we're working with Essex Construction, who are local and have a lot of affordable housing experience.
I know the YMCA is in discussions of purchasing a property across the street. Have you all talked with them at all, potentially providing services to your residents at the YMCA?
Yeah, I have. I had a meeting with the director of the Y, and we just to plant the seed. And I don't think they've sealed that deal yet either. I'm hoping they do, because it would be wonderful for our residents to have that available right across the street along with the LPD station. Yeah.
So I guess I kind of have some concerns about that. You get a lot of funding from Medicaid at the same time. And this one,
National Treasure Program.
is that, and that money's going away? I mean, are those federal dollars, you think you're gonna get those?
I am confident. We're also very committed to this, and if we need to privately finance it, we're going to find a way. There are some Medicaid changes right now locally. I don't know if everyone knows, but Pacific Source was administering a large portion of the Medicaid contract for Lane County, and they've dropped that contract. So Trillium Behavioral Health is picking it up, and we also have a contract with Trillium, and that will continue. So we will continue to serve the 400 to 500 individuals annually that we've been serving. And the housing funding landscape is certainly a little bit tenuous right now, but it's so needed. I mean, I'm cautiously optimistic that will turn around within our timeline.
More questions, more comments? Yeah.
Just along the whole transportation thing that I just can't get past and this is more of an LTD thing, but their hub and spoke system, I was doing some, looking at the 51 of what it would take to get to different parts of town. And that is from all the way out here, I can tell you someone that has rode the bus downtown, it is a significant trek from out here. And so I would say if you, as much on-site services as you could provide, otherwise you got to cross that and then you got to go an hour long on 51 to go to an appointment an hour back. And just seems like a terrible thing.
Yeah, that's a great point, and it's part of this whole plan was that we, for that reason, that being one of the main reasons, we wanted to expand our footprint to this area because we have people that we're working with that live here and want to stay in this community, but they were having trouble with that issue. And so this allows not only the housing, but the offices for support services. So we're really excited about it for that reason. Our main office is over near on Centennial Loop. So it is hard for folks to make it there from the other side of town.
I did the LTD trip planner to figure out where they're going to be from here.
It's so hard.
They're going to be like a half a day in to get to your office.
And also our workers are all community based. So we have a fleet of 40 vehicles and everybody's out in the community daily, meeting with people in their homes and their workplaces and wherever that needs to happen to, help be successful.
Can you talk a little bit about some of those wraparound services, that, kind of what you have on site there at your headquarters?
Sure.
And maybe not what you're, I know you're not promising, not what you're promising at the new location, but what you might see for the future out here.
Yeah, absolutely. So the menu, we try to be a one-stop shop for our clients and our participants because it is so hard to get around town and make multiple appointments with different providers and different doctor's offices and so on. So we try to do as much as we can in-house. Kind of bread and butter is behavioral health care. We're a mental health care provider on whatever level that means for people. So we have case management that helps people kind of manage their mental health care plan and their daily activity needs. And then we have a team of nurse practitioners that does healthcare and medication management with those folks. And we have those teams have wraparound services. So what that means is there's clinical drug and alcohol counselors on that team. There's registered nurses on that team. There are employment specialists on that team. There are supported education specialists on that team. So all of those services are available to anyone who's enrolled in that service. And also a la carte as well. If somebody doesn't feel like they need that level of intense wraparound service, they can pick and choose from the menu. And then we also have a drop-in center, which provides a lot of socialization, crafts, coffee hour, and then also support in getting on a computer and doing a job search or building a resume or whatever people need. And they also do recovery groups. They run socialization groups. They run other types of therapeutic groups out of the drop-in center. And then we have a on-site pharmacy. We have my department, which is housing services, so housing specialists and housing navigators that work one-on-one with people specifically around their housing stability needs and rent assistance. And boy, am I missing anything? And then, so important, peer support specialists. So people that have lived experience of mental health care needs and people that have lived experience of homelessness and lived experiences with substance use on staff to be that peer support, that person that they can can relate directly to with their experiences and share those experiences. Great question. Thank you for asking that. And all of that will be available at this site. We're thinking of it as a satellite location. And again, all of our workers are also very mobile in the community. I think I saw you first.
Yeah, that's a quick question. Do you see at some point
Oh, yeah.
I'm a peaceful agent.
Yeah.
Community trace this.
We do. We have a community garden built into the plan
Oh.
and a pet area, a little dog park built into the plan. And a outdoor gazebo, a picnic space.
So, have you the facilities that the teaching for the health protection city?
Yeah,
And-
Oregon State Hospital.
Okay, so can you help me understand the difference between your facility and what they did out there at the
Sure, good question, yeah. So the facility off of 99 in Junction City is Oregon State Hospital. And that is a inpatient behavioral health hospital. And so primarily folks end up there when they've had a psychotic episode and are unable to care for themselves outside of a closed facility, unfortunately.
As opposed to
this, which is supportive housing for people that are ready, willing, able to live in the community of choice and be a part of that community.
so they're not on lockdown.
Not at all.
Okay,
No, these are their own apartments. They have a regular rental agreement. They come and go as they please. They participate in the community in healthy and productive ways. Yeah, big question. Thank you.
You mentioned about the community efforts and getting together. Will there be an indoor spot for people to meet in this location?
Yeah, there's going to be a community building right on the Hunsaker frontage, and that's going to be a 2-story. It's going to look like a single-family house, basically, and it's going to have offices for our support workers upstairs, and then downstairs it's going to have a community room, a community kitchen, and some one-on-one meeting rooms and some group meeting spaces. Yeah, thanks for that.
So, I'm trying to visualize this. So you're gonna have some on-site support. You're gonna have your teams, right? Your nurse practitioner, maybe a prescriber, peer support, case managers. So what is their caseload gonna look like? Are they just going to be responsible for these 54 people, or are they gonna have 200 clients that they're dealing with?
Yeah, good question. Our caseloads are typically 20 to 30. And so there might be workers that are assigned specifically to this property, but most likely they'll share kind of a broader caseload, both for their skill set and interests as far as working with a variety of individuals. But we keep our caseload relatively small. 20 to 30-ish is pretty manageable for supportive housing. And then some of our kind of, I won't say lower level, but like the folks that don't need the intensive wraparound, those caseworkers, might have 40-ish or so. Yeah, great question. Yeah.
So, the services that are provided there, is it just for those that live there? And, 'cause at one point I did respite foster for OCP, and they had services there for those kids, but also others could come in this group. You're really guided, is it close to your serving on site?
We envision it being like a satellite Laurel Hill Center, where anyone that's, that lives in and needs services nearby will be able to come and receive services, get hooked up with whatever they're looking for on that site. So they'll serve the residents at the housing facility, the housing development, the community, and then they'll also be available and have office hours and have information and be able to do enrollments on site.
So does satellite mean like to the public?
Yes.
Okay, sorry.
Yes.
That part. Now I get it.
Thank you for forcing me to be clear. Go ahead.
So how are people going to access this property? Are they going to access it from Hunsaker, from River Road, or from that little street?
From Hunsaker will be the main entrance. And there's going to be some office parking behind the community building, and then both a sidewalk and a driveway into the main residential area. And then there's an emergency easement from River Road next to where the zone back is and the businesses there through that parking lot for emergency access.
I don't know, do you drive Hunsaker?
I do. I've been driving it pretty regularly to get a feel for that. And
Yeah, I mean, it's really bad, and people do not want to drive 25 miles an hour. And now you're gonna have an access point on that street, right after the terrible corner that the city put in. I'm just wondering, if it's sufficient for it to not be off Hunsaker, because that sounds like a really bad idea to me.
I am absolutely talking with the planners and whatever we can do to, they know that it's bad and something needs to change. I don't know what that's going to be yet. I wish I had more information, but it does need to improve, absolutely. I hope we can be part of the catalyst to help that improve.
So things are changing on Hunsaker. There's probably about 9 properties that are going to be affected by them taking their property when they do some changes on that road, and they are pushing that out to, I think, 28, 29 now. So
It's called traffic enforcement, slow the traffic down and speed bumps.
That would probably help.
Yeah.
There's a little access from this.
Yeah, it doesn't actually, there's a private residential property in between that road and this property.
Any other questions, concerns, comments, suggestions?
We have one from, is that okay if I say?
Yeah.
One from Brandon. He said, unsure if I can ask a question audibly, but is the facility going to be staffed 24 hours a day?
Great question. The answer is no. None of our supportive housing sites are 24-hour staffed, but we do have security patrols for the resident safety that do come by overnight. And then our service provider team has hours, usually from kind of staggered shifts from 8 a.m. to early evening, 9, 10 p.m., kind of depending on the property's needs.
That's it for the virtuals? Okay. Well, thank you very much. We appreciate you coming.
Thank you all so much for having us and having such great questions. I really appreciate it. Nice meeting you.